Today we're going to be doing a little Google versus therapist. Hello and welcome back. My name is Mallory Grimste and I am a teen therapist. You may have seen Wired's autocomplete interviews. I really love them. Or recently I came across Dr. Mike doing a doctor versus Google autocomplete video and I really liked that. And I thought, oh, it would be really cool to do a therapist versus Google autocomplete. And so I'm going to bring that to you today. We're just going to go right ahead and get into Google. All right, so we're going to take a page from Dr. Mike's book and we're going to go into incognito mode. That way my search history won't influence these results. I'm not even done with our therapists and already there's our therapist doctors. Some of us are. Our therapist essential workers. I think it depends. So this is probably coming up right now because we're in the middle of the coronavirus COVID-19 pandemic and a lot of states and areas are currently in a shelter in place. Non-essential businesses are asked to be closed during this time or to alter the way that they deliver services. So I think this is a case-by-case situation. I think that therapy is very essential right now, given what we know about the mental health impact of isolation and loss of routine and loss of social contact. So to that extent, I think that we are essential. And yet many of us have the capabilities of offering telehealth therapy via the computer or video or telephone. And so if it is safe to engage in therapy in that way, I say go for it. There's lots of different ways that you can do that. If you have your own private space, you can totally use that room. I always recommend using headphones for privacy, plus it helps with feedback so I can hear you clearly. If that is not an option, I know that people have gotten very creative. I've done telehealth counseling where people have gone into their closet for a little sense of privacy or the bathroom. I've had where people have actually gone out to their cars. So there's always some way of getting that as long as you have a good Wi-Fi connection. If for some reason it is still not safe, I do know that as long as people are practicing good, safe social distancing, that it may make sense to still continue in-person counseling. Are therapists psychologists? Some therapists are. So to go back to the doctors part 2, I am not a doctor. To be a doctor means that you need to have either gone to medical school or you need to have a doctorate degree. The type of degree that I have is a master's of social work. I went to school and from there I did my clinical hours and became licensed so that I can be a licensed clinical social worker. So there's many different paths to becoming a therapist. It's important to get familiar with them. Are therapists mandated reporters? You betcha. I have a sign that hangs on the wall in my counseling office, and it's where I remind people that I am legally and ethically obligated to report any signs of risk to self or harm to others. Safety is of the utmost importance here. Are therapists in demand? I'm going to say yes. I think that there are so many people in this world who could really benefit from engaging in mental health counseling and therapy. And I'm finding that as the stigma becomes less and less, that there are more and more people willing to come into the office and meet with a therapist. Are therapists expensive? I think that this term expensive is relative. If you take into account all of the overhead costs that goes into not only becoming a skilled licensed therapist that knows what the heck we're doing, then I think that's well worth it. I liken it to the idea of when you buy a new car, that sticker price, it immediately goes down in value when you start to drive it off the lot. Whereas I think that when it comes to mental health therapy, the sticker value actually goes up. I think your value actually increases over what the sticker price is because the information and the insights that you gain from counseling go way beyond that in-session time. You're taking that into your day-to-day life. Are therapists crazy? My dad loves to say, you know, Mallory, it takes one to know one. And I kind of agree with that. I know, like as a therapist, like we're not supposed to call people crazy. I use the word crazy all the time. As long as you're not using it as like a slur, I think that's fine. I will say I am totally crazy sometimes. I get a little crazy or energetic around nerding out on therapy stuff. I'm also a human being. I think we all have a little crazy in us. So maybe I do think that to know what you're doing as a therapist, you have to have some life experience that brought you into this career path. I don't know. You tell me. Are therapists crazy? Let me know in the comments below if you think we're crazy or not. By the way, if you are really enjoying this content and you want more of it, please make sure, if you're not already, subscribe to the channel and hit that bell notification. It really helps to grow the impact and awareness of all of this mental health information. I am really passionate about reversing the rising rates of depression, anxiety, self-harm, and suicidal ideation in teens, which is really the main reason why I created this channel. Are therapists free? So free in terms of financial costs. There are some therapy programs that do provide counseling services for no to low cost. Free in terms of time, work, and investment? Heck no. There's a high value investment on that end. Are therapists worth it? I would say 100% absolute yes. I'm just going to leave it at that. Yes, 100% yes. Are therapists happy? Again, I think that therapists are people. I think that if your therapist has done the necessary work on themselves, then I would hope that they know how to experience happiness, especially if they are teaching and helping you get to that level too. At the same time, we have down days. We get angry, we get sad, we love, we hate. We have the full spectrum of emotions. Just because we are therapists doesn't mean that we are immune to the human experience. Let's do another one. So this time we're going to say, what therapists say and why they say it. Oh, I'm gonna explore that a little bit. Interesting. So this looks like it's a book on what therapists should say. That's basically it. It's a book. I didn't even know that. I know that there is a running joke about the catchphrases that therapists say, especially if you're a rookie or starting out therapist. When you're first starting out in therapy, it's totally normal to have silence. In our society, we don't do well with silences. It's why awkward silences are a thing. And so because of that, sometimes when you are new to therapy or you are a new practicing therapist, sitting in silence can feel really uncomfortable. But that's kind of where the magic happens. So I won't get into that right now, but I know a lot of rookie therapists, when they don't know what to say, they'll say things like, so tell me how you feel about that. Hit like if you have ever said that or if you've had a therapist say that. Now, of course, there is some reason and rationale for asking that. I myself ask that in session, though I'm pretty intentional about when and how I say that. I don't just say it as a filler phrase. I say it because I'm really genuinely interested in helping you identify what it is you're feeling so that you can put words to your experience. What therapists take my insurance? This is a really great question to ask, especially if you're not in a position to pay out of pocket or self-pay for a therapist. Now, that being said, I wouldn't discount self-pay or private pay therapists because if you have it in your budget, a lot of insurance plans now offer what is called out-of-network benefits. So what that means is that you can see a therapist at their rate and potentially get reimbursed up to a portion of that rate if they are not in network with your insurance. What therapists don't talk about and why? Oh, this is debatable because, there are some old school therapy models that say never talk about yourself, don't ever offer anything about yourself in the therapy room, and that's just not my style. I think that using information about your experience and yourself as a therapist can help benefit the client in the room. Plus, I think it would be a little weird if I'm asking you to tell me everything about you and I never offer anything about myself in exchange. Now, of course, therapists really should not talk about their own active issues in counseling. The counseling session is for you as the client. It is not for me as the therapist. If you find that your therapist is using your session to talk more about their own experiences and learnings and never bring it back to what you want to talk about, that's a red flag, and it's something that you should bring to their attention. What therapists do, we change lives. But seriously, we do. We don't give advice. I will tell you that. That's a common misconception. I myself thought that when I first went into my social work program. I thought I give excellent advice. I think everyone should listen to me. We all think we have perfect advice, which isn't accurate at all. Therapists are really about helping you learn how to think for yourself and to trust what you already know is intuitively true. That's pretty much it. We help you uncover past learned messages and behaviors that are no longer serving you and learn new effective ways of being and doing and thinking and living and loving so that you can live your best life. What therapists make the most money? I have no idea. I would love to know that too. What therapists think? Ooh, this is a great one because I think a lot of clients have the misconception or misunderstanding that a therapist is sitting there silently or maybe actively judging you. And to some extent, we are, but not in the way that you think. A lot of us are really seeking to understand what your purpose is for coming into therapy, where you want to be, and how far you want to go. So we're constantly trying to think and assess, is this the right path for you? A good therapist will check in with you along the way. Asking your permission is really important so that we don't end up taking you down a painful rabbit hole that isn't going to help. What therapist can prescribe medication? So traditionally speaking, therapists can't prescribe. In the state of Connecticut, psychiatrists who are medical doctors and psychiatric APRNs can prescribe, but therapists cannot. Now, some psychiatric APRNs and psychiatrists do provide therapy too, but they're still considered nurse practitioners or doctors. So just something to keep in mind. So let's go on to the next one. How therapists. Oh, this list is really good. How therapists mourn. Therapists mourn just like every other human being. When our clients hurt and go through painful experiences, we do too. We care about you. Part of what makes therapy so effective, especially the type of therapy that I practice, is it's really relational. It's really important to develop a healthy therapeutic relationship and to use that as a template for other relationships going out into the world. How therapists evaluate the patient's strength. Oh, I love that. So, I don't have a great answer for that though. I think it is a mindset and a training aspect. I operate from a theoretical orientation called client-centered therapy, which is really based on what does the client want? Not what do I want, not what did the parents want, not what does society want, not what do their friends want, not what school wants. It's what do you as the client actually want. I really look and see to understand what purpose does it serve. What's the opportunity for growth here, and where can we take that moving forward? How therapists work? We work just like everybody else. We get training, we get consultation, we learn, and we show up doing the best we can. We also have to write a lot of notes for documentation, so that part, not my favorite. How therapists treat depression. Therapists treat depression in a variety of different ways. There's a lot of different skill sets and models out there. Myself, I offer individual and group counseling. I use a lot of cognitive behavioral therapy and dialectical behavior therapy, but there's a lot of different ways that you can treat depression. How therapists treat anxiety, I use the same therapeutic models, CBT and DBT. How therapists ask questions. This is actually a great search term. So a lot of people like to ask what are called closed-ended questions. So that is a yes or no, and that is something that just ends the conversation right there. Therapists, we love to ask open-ended questions or what's called insight-oriented questions. So when we ask you a question, we do our best to help you think and engage with your own thinking process so that you can come up with an answer that's going to be helpful, insightful for your benefit. How therapists read body language with a lot of training. Can't give away all my secrets. How therapists feel about clients. Oh my gosh, I love my clients. I think that they are all so freaking amazing. They do such hard work, and it takes such strength and courage to keep showing up when you just don't feel your best. And to allow me to be part of your journey, it just feels so humbling. It feels so amazing to be trusted in that process. So that's how I feel about my clients. Though again, therapists are people. We may not always like our clients. And to be honest, if you find yourself not liking your therapist or not liking your client, you're not gonna do good therapy work, and it's time to refer them out to somebody who does vibe with them. It's a tough conversation to have, but it's what's necessary. How therapists deal with transference. Okay, so if you are not familiar with transference, it's really where the work gets done. So remember when I talked about how the therapeutic relationship serves as a template or a guide for other relationships? Transference is when a client puts their own ideas of who the therapist is onto the therapist and onto the relationship. This can come in a variety of different ways. I purposefully do not disclose my age to any of my clients or their families. Not because I'm ashamed of how old I am. I'm actually very proud that I've made it this far in life. I do this because of transference. So it's really important, based on what the client needs, for them to experience me however they need to experience me. Whether that's as a mother, as a sister, as a friend, as a teacher. And that's what transference is. How therapists help? A variety of different ways. I think I've covered that already. Can therapists diagnose? Yes, we have to be able to diagnose for insurance reimbursement purposes and to document medical necessity. So medical necessity is the idea of knowing what it is that you're treating and is it medically necessary that would warrant an insurance paying for that treatment. Can therapists prescribe medicine? I think I talked about that already. No. Can therapists smoke weed? There are people, I'm sure that they can. Should they smoke weed in session? No. I don't know if you saw but John, what's his name? John Stamos, Uncle Jesse. Love him. I was so happy with the way they were portraying a therapist in that show until this happened, and then it just went downhill from there. He pulled out some weed and started smoking it, and I was like, So one of the important ethical tenets of being a therapist is that you need to be clear-minded, which means that you can't be in session high, intoxicated, or drunk. Same goes for the therapist. We can't show up high, intoxicated, or drunk. So, yeah. Can therapists text clients? Kind of. So, texting is not secure if you're going on what's called SMS text. That being said, clients have the right and ability to decline their HIPAA privileges if they choose to initiate and continue a texting exchange with your therapist. I myself really try not to text clinical information. I try to save it for our therapy sessions for a variety of factors. Can therapists diagnose ADHD? Yes, we can. Can therapists testify in court? Yes, we can. Again, this is something to pay attention to though. Just because we can doesn't mean we should. So So there's a difference between what's called an expert witness and a, what is it called? Not an expert witness, but a character witness. You just want to be sure, because when a therapist is subpoenaed and on the stand to testify, are they talking as an expert, or are they talking as your therapist? And if they're talking as your particular therapist, you probably don't want that to come out in court, because then they can ask about anything, and your privacy and confidentiality can actually be used against you. Can therapists do phone sessions? Yes, we can. In fact, right now with the coronavirus shelter-in-place mandates all throughout the country, many of us are. Whether it's telehealth or on the telephone, it's important to double check though that if you're using your insurance, whether you are using it for reimbursement as an in-network or out-of-network benefit, that you check if phone sessions are covered. A lot of therapy plans will cover video sessions, but not telephone sessions, which I think is ridiculous, but that's just me. Can therapists diagnose autism? Yes, we can. Can therapists tell police? Can therapists tell police what? If it is a mandated reporter situation, we totally can. A therapist cannot violate your privacy or confidentiality without your explicit permission unless it is a safety concern. I have myself as a therapist, and especially when I was a crisis clinician, if somebody was calling me and talking about that they were actively suicidal, I can't always leave my office and go to that person's house, nor should I, especially if it's a situation like that. And so I've had to call the non-emergency line of a police department and ask for what's called a welfare check, which is something that you can do too if you're concerned about somebody. And what they do is they'll show up, they'll just knock on the door and lay eyes on the person, the situation, and just make sure that they're okay and safe in that moment. If there is still a level of concern, then they can require that they go to the emergency department to be evaluated for a psychiatric evaluation. My therapist, I knew this was going to come up. My therapist says, let me know in the comments, what are some things that your therapist says? I'm sure some of them are really helpful and really funny. Yeah, my therapist meme. I just did a whole bunch of therapy meme videos. You should totally go and check them out. I'll leave some thumbnails like over in this area so that you can go and check some of them out. Let me know which one is your favorite. My Therapist Aid is an awesome worksheet website. So that's where that is coming from. My therapist ghosted me. Ooh, that's not okay. Are you sure that they ghosted you? And if they did, I would try to reach out to them again and get a little more information on what actually happened. My therapist knows about you. Oh gosh. This one is funny. I know a lot about a lot of people that I will probably never meet. Also, you should totally view that as an honor and a privilege that they're willing to talk about you in their therapy session. It means that they're giving up some of their time to work on an issue that's related to you, which could really be beneficial. So you're basically getting like secondhand therapy here. My therapist triggers me. I hope so. Not in a negative way, but if we never make you uncomfortable and we never push you to a point where you can practice and learn from growing, then we're not doing our jobs. I let my clients know in the beginning that there will be times where they leave session hating me. Not me as a person, but just what I've asked them to do in that therapy session. Just like when you work on developing your physical health, when you build muscle, it's when your muscle gets that level of fatigue where it's not like painful in like a hurting sense, like you don't want to actually hurt yourself, but it's just uncomfortable enough that you're starting to work that muscle. We do that with your emotional muscle too. Yeah, we're gonna trigger you. If it ever gets too much or too far, you gotta let us know. As therapists, we're pretty receptive to that, so just let us know. My therapist abandoned me. Also really sad. So again, I think that's similar to the ghosted one. I would check in on that. My therapist is an intern. Yes, so before we can become licensed therapists, we have to practice, which means that we have clinical internships. Some of that is before you get your degree. In some other places, it's where you're actually working on your licensing hours. Like I know in the state of California, they tend to call their therapist interns when they already have their degree and now they're working on their clinical work. Whereas in the state of Connecticut, we call interns people who are actively working on their degree. Having a therapist as an intern can actually be really great because they're so new and eager to learn to the field that they're going to be like on top of this stuff. Plus, they also have a more experienced supervisor who's overseeing all their work. So you're kind of getting like two therapists in one, which is pretty cool. I have so enjoyed doing this therapist versus autocomplete show with you today. And if you want more videos like this, hit the like button so that I know. If you don't want more videos like this, hit the dislike button. I want to know that too. If you want to learn more about how therapists can help, go ahead and watch the video on your screen right now. It could really help. And please make sure that you share this video. You never know who you could be helping in the process. Thanks for watching.